Welcome everyone to this next plenary session in Keynote on transforming the fight against old and new pandemics. So first, a thanks to you, DJ PM Love. I'm so grateful, Pamela, for your sharing your talents as a DJ, but also want to say for all that you do as an advocate and a leader in the work against poverty. For setting up this session, as I said earlier, and as we've talked about, there is rightly a lot of attention this moment on pandemic preparedness and global health security. But how we define that security, for whose benefit, and what we mean by pandemic preparedness matters enormously. I think that global health solidarity comes much closer as a way to describe the goal, and focusing on health systems that guarantee everyone access to life-saving treatment and care, vaccines, quality nutrition, protection of their dignity and human rights, and investing in tackling the pandemics and challenges that communities face today and stopping those of the future in the process. And so I'm really thrilled and honored to welcome a very special guest who has been a remarkable champion leading the way on global health equity for decades. Joy Phumaphi is currently the interim co-CEO of the Clinton Health Access Initiative, CHI. She has served as a member of parliament and then later as Minister of Health of Botswana. As Minister of Health, she established the first comprehensive HIV/AIDS treatment program in Africa at the height of the pandemic, and when many said that it was not possible. She's also served in senior roles at the WHO and the World Bank, and always played a groundbreaking role in those institutions, and as a board member and chair of other key international institutions and commissions focused on health, nutrition, climate, women and children, and more. And she's also really importantly the executive secretary of the Africa Leaders Malaria Alliance, which has been which is an alliance of 49 heads of state and government that, with her leadership and others, has led to remarkable progress against that disease. And it's also, I just want to say for our results folks in the US working on housing issues, it's also noteworthy that early in her career, she also held a cabinet responsibility for housing in Botswana and established a groundbreaking policy that provided housing for all residents regardless of income status. So Joy, just to say, I and our global partners have learned so much from your leadership over the years. And I got to say, just last month at the Global COVID Summit, I was, really inspired by hearing your remarks. When we've seen so many global failures in the face of this new epidemic, you had such a clear vision for what's needed for equitable health systems we have to build. And in particular this year, the importance of the Global Fund. So here today are advocates from across the US and around the world. We'll come back in a bit for a few questions as time allows, but and we'll invite folks to use the question box at the end at the bottom of their screen to ask questions. But for now, Joy, just a big welcome, and we'd love to hear some remarks from you.
Thank you so much, Joanne. I apologize, my video was off. Thank you so much. It's really a pleasure and an honor to be here. I just wanted to share with you today what I think countries need. We are all familiar with the WHO pandemic preparedness requirements that are being accepted, and most recently at the World Health Assembly, we are familiar with both the global and the national requirements. So I will not go into that. But I just want to share with you our affected, and many have played various roles in this saga, some more actively than others. We are all there a quarter of a century ago as we in developing countries grappled with struggling primary healthcare systems. And at the same time, with these struggling healthcare systems, we were charged with developing them in such a way that they can educate and communicate effectively with communities, informing them about health and enhancing their participation and health-seeking behavior. The primary healthcare systems were to address linkages between health, nutrition, food supply in order to offer dietary support and guidance to communities. And they were promoting access to safe water and sanitation. They were providing community-level access to maternal, newborn, child, and adolescent health services that we were able to provide, and even reproductive health services. They were providing vaccination of all children against vaccine-preventable diseases. And they were being designed to prevent, control communicable diseases like malaria, neglected tropical diseases, and tuberculosis. And they were preventing and controlling, to some extent, limited as it was, NCDs and other non-endemic corrective component, as well as providing essential drugs and commodities. So these were sort of like the essential elements of the primary healthcare system. We focused more on some areas than others. We are often guided by of what was most politically what you call it in vogue at the time. Sometimes it was equity, the distribution of services and programs, including access, quality, and measurable outcomes and impact. Or other times it was the use of appropriate technology, or sometimes it was multi-sectoral approaches or community engagement participation, depending on what was being called for. And sometimes it was even responsibility and accountability by the government. But it was never all the principles together being applied effectively and consistently together. So challenges consistently reared their heads in the numerous cross-cutting areas because they were not paid particular attention. Sadly, there was limited, non-comprehensive, and often not well-trained or well-managed, though hardworking, little workforce. And there were poorly constructed, limited, and inequitable, unaffordable systems and poor financing models. There was an inefficient and limited non-electronic patient data management system, an inefficient, unreliable, non-electronic public health data and surveillance system that could not effectively ensure ongoing collection, analysis, dissemination, or monitoring of the health communities. There was limited diagnostics and poor accessibility to laboratory support services, limited and unreliable logistics and supply chain management, poor policy and legal and regulatory environments, constrained health leadership, and management gaps across the sector. Non-use of appropriate technology were indicated, and poor and limited multi-sectoral engagement. And these approaches were very, very limited, and responsibility across the government was not even spoken about. So these were the primary healthcare systems that we were working in and that we were building up gradually, slowly, because there was no pressure to move fast. The progress, therefore, was slow and very painful for the communities. And then, boom, HIV/AIDS hit. Suddenly, we had a new partner, came at us, out of nowhere. And we started appreciating the need to speed up the strengthening of these primary healthcare systems and the importance of each element, every principle, every cross-cutting area suddenly became extremely important. Sometimes it took a long time, like it took, a revolution in the communities. There was a global movement of people who are living with HIV/AIDS, but we learned the value of working together across the social determinants of health. We worked together as a global community. We created the Global Fund to facilitate access to shared technology to accelerate progress. Indeed, by 2015, progress seemed to be so on track that we're able to set really ambitious 2030 goals on universal health coverage and well-being for every human being on the planet. And in 2019, when COVID-19 sent progress spiraling down, making maternal, newborn, and adolescent and reproductive health targets totally unachievable. 2 decades of progress against TB, against HIV/AIDS, against malaria suddenly tumbled and we've been threatened. Now, why did this happen? Why did we have a 19% reduction in people treated for drug-resistant TB, or 37% drop in those treated for extensively drug-resistant TB? Why is it that there was a drop by 11% and 12% by young people for HIV, and HIV testing dropped by 16%? Why is it that even though malaria stakeholders tried the best that they could, Herculean efforts, primarily by community health workers, with the support and the funding from partners and their governments, tried to sustain efforts, they still fell short of meeting testing targets by at least 4.3%. So family after family was plunged into poverty by the impact of this pandemic, into ill health, into despair, translating this into a human cost for communities that can only be described as staggering. All the lessons that we had learned collectively as a global community and individually as countries with HIV/AIDS were set aside as technology was hoarded, essential health services were interrupted, and inequities between countries and within the countries were exacerbated. The onset of the pandemic triggered the greatest supply and logistics challenge in history, as the world raced to protect populations against the virus and focused on being insular on themselves. The lack of effective primary healthcare systems in countries, as well as the supporting global architecture for pandemic preparedness, the lack of that structure, and the response and the lack of response had clearly jeopardized the ability for countries and the global community to mount an equitable response or ensure resilience in the face of COVID-19 and the accompanying complex and competing health and economic crisis. So we had not learned from HIV/AIDS. Indeed, it is quite clear that the world can't afford to choose between the old pandemics and these new ones and stopping the new ones. And for me, this is the message that I would like to give today, that we know what the basic elements of primary healthcare are. We know what the principles are that are supposed to drive equity, access, including the use of new technologies, the adoption, the sharing. We know all these principles, and we know that we can't afford to continue to have primary healthcare systems that are weak, because pandemic preparedness is not just about a global health security structure, but it is about a strong primary healthcare system. It is about good governance. It is about political leadership. There is an undeniable lesson from the COVID-19 and HIV/AIDS pandemics that mitigating the anthropogenic drivers of zoonotic spillovers is long overdue. So that lesson we must not forget as we continue to focus on pandemic preparedness and strengthening of primary healthcare systems. The next pandemic may just be even more deadly than COVID-19. So my message today is, let's prepare now. All of us have a responsibility. When the Global Fund speaks about strengthening primary healthcare systems, let's talk about it in a comprehensive manner. And let's not pick and choose. Let's talk about the whole primary healthcare system and not say we're only going to strengthen this component. Strengthen what the country needs. Let's build a fit for purpose primary healthcare system in every country. Let's have comprehensive pandemic preparedness and response capabilities. Let's have a world with a robust global health security system that can protect even the weakest amongst us. Thank you so much.
Joy, thank you so much. I think that was probably one of the clearest descriptions I've ever seen. I mean, both the historical, what HIV and the response to it brought, but then also the what COVID has wrought and why primary healthcare systems matter so much. Maybe, and folks, we invite folks to put some questions in, but I also have a few questions as well. I mean, could you say, you mentioned that, you know, you touched on the Global Fund as well, and I only mentioned it in part because we're all working, all the people that you have online here are working on the Global Fund replenishment. If you could say just a few words about why the Global Fund is important in building out these primary healthcare systems, and you know what you've seen maybe when it worked really well, and agreed it needs to be a key part of an overall system, but how do we use this platform we built to actually drive the things we need for the future? So anything more you'd say on that would be great.
My feeling is that one of the greatest achievements of the Global Fund has been working with communities. Yes. This has strengthened the importance of community health workers. We all know that women are actually the most active community members in healthcare, both in terms of seeking and in terms of providing healthcare. But at community level, that is even more critical and more important. Practically every community health worker is a woman. And they understand the community, they live in these communities, they know how to engage with them. And I believe that one of the biggest contributions that the Global Fund has made is starting to support community health workers, but supporting them in such a way that you actually institutionalize quality community healthcare workers that can work across the primary healthcare system and not just focus on HIV/AIDS, because this is one of the biggest mistakes that we made when we started fighting the HIV/AIDS pandemic. The community health workers were just focused on HIV/AIDS, but they have to work across the board in order to be able to strengthen the ability of communities to respond in an epidemic, which we saw was one missing link with the COVID-19. But those countries which actually continue to have strong community engagement that was established through fighting the HIV/AIDS pandemic, were able to respond much more rapidly in terms of educating the community and encouraging the use of vaccines and protection than the communities that didn't. So that to me is a major contribution. I know that we tend to focus on, of course, the supply chain and logistics contribution is also an important one. But I believe that this one is a very critical pillar to primary healthcare that needs to continue to be built on and to be made even stronger.
Great. No, very, very clear, and kind of links to another question that was posted, which is just big thanks for your words today. And can you share more examples and ways we as advocates can demand more to strengthen healthcare systems, particularly in lower income countries that have been disproportionately afflicted with weaker systems and with not having the resources they need? So community health work is a great example. Anything else that you can share with us as advocates, you know, about that? What else we could be pushing for in terms of building out primary healthcare systems?
Yeah, absolutely. You know, I think one of I don't know whether it is that we have very short-term memories, but there is a lack of understanding about the fundamental determinants that shape health. And this has been particularly evident in the failure to support the vulnerable populations amongst us. And it is a ball we drop consistently. When COVID hit, we forgot that there were people living with HIV/AIDS who were particularly vulnerable, and we did not make them a group that should be targeted for vaccination, which we should have done automatically. But in a lot of countries, this was not done. And there is also the striking paucity of social and economic protection policies, at the domestic level, that continue to exclude huge populations from various aspects of healthcare. Sometimes you will find that a primary healthcare program that is targeting the poor, that is described as sort of the essential package, does not have dental health, does not have eye health, Does, you know, some of the basic does not cover mental health. And we know the growing incidence, you know, of mental health does not cover disability. So what type of health, primary health care package is being offered, you know, to the vulnerable populations, to those who are traditionally disenfranchised when it comes to a comprehensive healthcare system? So I think, you know, we need to keep an eye on these policies. And I think an important lesson from COVID-19 is that we need solidarity-based mechanisms to provide affordable medical supplies internationally across the board. It is not just beyond the sharing of technology. And I mean, ACT has been a major, has been a good introduction, but we have learned from COVID-19 that we need to go beyond what ACT has been able to provide and actually come up with a logistics and supply chain management program that is much, much more efficient than the one that we currently have. So I think that these are the areas, and we need to push the private sector. The pharmaceutical industry needs to assume responsibility. We did that with HIV/AIDS and we succeeded. We need to do that much more aggressively, I believe, with COVID-19. And with even with the cancer treatments and the other, you know, the non-communicable diseases, where the greatest disease burden is now globally, even amongst developing countries.
Great. Great. Thanks on that. A few more questions. One about what do you think should be done, or how can we do, you know, you've talked about the key role of communities and civil society too. What do you think should be done to be able to have more youth advocates? And the person makes this point, and I think it's true for CSOs more broadly. They often leave because there are no salaries, you know, or they can't continue that work. I mean, how important is that civil society and community-led work, and how can we support more youth advocates to do this work?
You know, for us in Africa, the youth are our present, they are our future. And if we ignore them at the peril of the continent and of every economy on the continent. So we have to accept that youth need to be empowered, because we cannot achieve anything without young people. They have to lead, they have to be in the driver's seat, and we must put them there. So the more civil society pushes aggressively for this, and not just in the social fora, but in political fora as well, because we tend to separate social and you know, economic and political fora. But unfortunately, for a human being, all of these are combined. What is actually going to end up benefiting an individual and the health and well-being of individual is a combination of all these factors. So if one is missing, if there's no political leadership and engagement and commitment to the community and to improving their well-being, it is not going to happen. So I believe civil society has got a unique role to play in advocating for this and in actively engaging young people. So, and I feel that we have reached a stage now where we should actually make it a requirement that there should be equal participation of young people. So it should not be tokenism. We should not have civil society organizations where the leadership has got, you know, 2 young people, at least half. If the population of a country has got 60% young people, then that should be represented in the leadership of the civil society groups, at least. And the civil society should then push for government and other structures to be the same, because this is what is going to move us forward.
Great. Thanks for that. And it's good. I mean, it is a good challenge for all of us, as you say that, and also for just not separating this, you know, social and political and economic, but really bringing those together, and not separating them and sort of taking away people's power to actually be able to engage on all of that. And there's another question, and maybe Joy, for you, because you have worked and operated in so many spaces. So it was just a question about how can we work towards separating pandemics from fear-based and xenophobic models of thought, you know, continuing, like, how do we continue to talk about these things and share information in ways that are not about who has it or where it came from, but that we're a global community connected on this. So I mean, I know that's a big question, but given the roles that you've played, anything you'd say about that?
You know, for a larger part of my life, my work life at least, I have been working with political leadership. And I always feel that a lot of social norms, behaviors are actually, they have to be built. If you want to change, you know, it's not something that is going to happen overnight. People, we know that prejudices and biases are wrong, and that it is wrong to discriminate. But you need a legal environment and a governance system that will enforce the good governance and the right policies. And so I believe it starts really with the political leadership. They have to demonstrate the good governance and leadership. And so we should push for that, because I think engaging consistently in the social is not going to get to the change that is required. I think the governance structures, the political leadership, the legal frameworks have to be enforced, and they have to be enforced consistently and uniformly, so that they can actually change the behavior of society and create a new normal. That is my experience. It is a difficult situation, but it is not a situation that should be ignored. We need to continue to work on it, but the political leadership and good governance, I believe, is where the solution lies.
Thank you. Thanks. And we're just about at time, but I'm just, you know, you're talking to a group of advocates who, you know, across the US, across the world, some folks up late at night too, because they really wanted to hear from you. You know, I don't know, maybe just a sort of in closing, anything you would say to them, to be saying to their policymakers about really what the opportunity of this moment is around, like the vision that you had about this sort of integrated and equitable primary health care system and the opportunities we can build. So just you know, I don't know, a few sentences, what you would say in close to them to be able to bring to their policymakers about how do we take this moment and drive something bold and make something positive out of it.
You know, I think, you know, every challenge has got a huge silver lining. And I think, you know, I believe that is what drives a lot of us who work in global health and in development as well. So for me, the most exciting, you know, aspect of development is democratizing it. And democratizing it is making development owned by the people. So let us go out there, let's deliver democracy to health, with health decision-making processes and institutions at national, international levels that are accountable, that are transparent, that are equitable, that are inclusive, that are participatory, and so we need to go. So let us fight this fight, because there is no better time than the present. You know, when you are coming out of a shock, you know, like we have had with COVID-19, everybody is ready for change. So let us drive this change, because it can happen, but only if we move and if we drive it.
Thanks so much for that. I mean, thanks so much for that vision, and that it is about not just the stuff in the field, but how we do the work. And so thank you for that. And Joy, thank you for all of your impact in, you know, deep commitment and your leadership in the world. And thank you for taking the time to be with us today. We are really, really grateful to be your partner and to get to work with you on this work. And thanks for that, that vision that you just shared with us as well. So thanks a lot for being with us.
Thank you very much, and thank you for having me. And thank you for all that you are doing for global health and for those who have been left behind.
Yep. Thanks for your partnership.